I started my career off in the medical assisting field, in the doctor's office. It was a private physician, and I did everything from bring the patients back to give injections, draw their blood, run lab tests, urine tests, blood tests. I assisted with minor surgeries, did EKGs, did x-rays, anything the doctor needed, I did for him. So that's how I started out in the field. And then I decided that, that teaching bug came back and I wanted to get into teaching. And after listening to my dad, who said if you're going to teach something, you have to love it. And so that's how I got into teaching. In fourth grade, I had a fourth grade teacher who was just excellent at getting the students, all of us involved, making you feel important, and it was easy to learn from her. And I also had a high school teacher that I wanted to emulate, and I wanted to be a high school instructor. And probably foremost, my dad was, after he retired from being a fire chief, went into teaching firefighting and fire science. And so his love of teaching and love of teaching something that you love to do, that's kind of where it instilled and really got the bug in me. I went to school for medical assisting here in Omaha College of Health Careers. And then I went into the field for 20-some years. And then in the middle of that, I decided I wanted to go back to school. I was teaching at that time. I taught in a couple of different schools. The last one before Metropolitan Community College was Allegiant Health. They had a medical assisting program. I decided to go back to school and get my bachelor's degree, and I have a bachelor's degree from Bellevue University in healthcare management. And then I got that education bug back again. Like I said, I like to go to school, I like to learn. And I went back to Bellevue, and I have my master's in healthcare administration. I got to Metro at the very beginning. Was Allegiant Health had a medical assisting program, and we kind of absorbed into Metropolitan Community College for their ability to offer the associate's degree. And so the students could then take the medical assisting diploma and if they so desired, go on in their education. And if they wanted to go to school and go into nursing, or if they wanted to go into healthcare management or any other field they desired, that opportunity was there for them. I knew I wanted to do something in the healthcare field and taking care of patients. So it was kind of nice to incorporate that and then find something that I could do and still be at home with the kids. That's the nice part of the medical assisting program, is because you do have a chance to bring the human side of life into that patient care. The patient's generally not as sick, so that everything is not just do this test and do this procedure. You have a chance to talk to them, get to know their families, and it's more of a relationship rather than strictly medical procedures. The thing that I want to leave with the students that I have in the programs is that it's the love of people, compassion, that caring attitude, integrity, things you can't teach. I can teach them how to draw blood and how to give an injection and how to do an EKG. It's very hard to teach compassion and integrity and humanity. And so, but hopefully they have to get that from the instructor. They have to see it in you, and I think they take that with them then. I treat the students how I want to be treated, how I want to be respected. They know that I care about them and I go the extra mile if they need something or if they don't understand something. They know I'm there for them. And so I think by being there for them, they tend to, they develop that skill to learn to do the same thing. So I had a high school English teacher, Mr. Capps, and he was such a very good teacher at relaying information, getting the facts down, but he did it in such a way that you didn't realize you were still learning it. And so I think that's how I've tried to emulate is get the information across so that it's not a drudgery, that it's a fun experience. I mean, it's a very serious subject in medicine, but that you have to have fun while you're learning, or it doesn't stay. Yes, I want them to take from the program not only the skills, those are important. The doctors expect them to know how to do what they need them to do, but they also need to take away that love of the profession, the love of people. That's what I want to make sure that they leave with, not only the skills to do the job, but the skills to be the right type of human and the right type of medical caregiver that they need to be. Here at Metro, you see that with the instructors. You see a passion for teaching and giving that knowledge to students to set them out on their way to careers. And you see it all over the campuses. And it was a nice fit for me, because that's my philosophy. I would have to say that my dad was probably my mentor. He was one, as I was growing up and watching him lecture all over the country, he was known all over the country as the fireman's fireman. They knew that he did the things he did as a fireman and as a fire chief, and then when he became an instructor in the fire science field, they knew that his love of that field, it just came through in his teaching, and that inspired me to do the same thing. When I became a medical assistant and then decided to go back into the teaching part of it, that stuck with me. You have to be who you are, love who you are first, and then love what you're trying to teach. It has to be there. I think students realize they can tell when an instructor is just up there saying words and teaching. They don't, they realize that, and it's hard to convey the message. People I don't think listen as well. But if they know you really care about it, they tend to listen better. Just to be who you are on the inside first, and that's going to shine through, and it's going to come through in everything that you do. And as my grandmother used to tell me all the time, you have to get happy in the same pants that you get mad in. So you have to take life as what it is, and things can happen to you, but at the end of the day, you're still you, and you have to be who you are no matter what happens to you. I think of the students that who would be interested in the program, or people out there that would be, thinking about what is a medical assistant. A lot of people don't know exactly. They're just the people at your office. But it's a field that you can do a variety of skills. You're counted on by the physician. You work right with the physician. You get to do so many different things, from, like I said, from drawing blood to doing vitals to assisting the physician in a minor surgery if he's putting in sutures. To the front office. But you also get to have that humanistic factor where you can get to know the patients and their families in a setting that's not as critical as a hospital, but as important. As healthcare has evolved and things have become more and more expensive, it's become imperative that we solve a lot of the healthcare issues before the people have to go to the hospital. And so the clinic has become a big part of that link in the healthcare chain to get people healthy, keep them healthy, so that they don't end up in a hospital. So the medical assisting profession has become more and more important in that role as healthcare moves forward. I am Dona Marotta, the program director for the medical assisting program for Metropolitan Community College.